Care managers in Japan. Now in 2024, Japan is a super-age society with 1 in 4 people over the age of 65. The wish of most people is to age in place, growing older in their own home and community, even if they require care. The mechanism for achieving this in Japan is care management. This video features care management and a care manager's job in Japan and initiatives of care management in Thailand. This video covers 5 topics. 1. What is care management? 2. The 5 steps of care management. 3. Care coordination methods and required skills. 4. 3 important perspectives in care management. 5. Care management initiatives in Thailand. Care management professionals or care managers are relied upon by older adults and their families as indispensable in providing care and support for them.
She's such a good person. I really like her a lot.
She supports us in many ways, which gives us great peace of mind.
She supports the whole family.
What exactly is the work of a care manager? Shizue Shimura has been working as a care manager for over 20 years. She oversees a couple in their 80s. The wife's care level is 3, and the husband's is a lighter level 1.
How are you?
I'm doing well.
Are you doing well in rehabilitation?
Yes, I'm doing it well. At the daycare center, after they take my blood pressure and pulse, I do physical exercises and then rehabilitation using equipment, and then foot exercises.
I referred her to the daycare center that focuses on functional training. I thought this was best suited to her.
The wife suffered a stroke in 2008 and since then has continued with rehabilitation 2 or 3 times a week. The husband, who was supporting his wife with her rehabilitation, had a fall a year ago and was assessed as care level 3. Since then, with rehabilitation, the husband has recovered to care level 1. At present, with health care, long-term care, and daily living support provided under care management, the couple continue to live together with support from their 2 daughters.
She responds to my requests immediately.
Even if I wanted to care for my wife, I couldn't do it. The care manager supports us on many different levels, which is reassuring. We can discuss anything with her.
What helps me the most is how she understands the client's personalities and suggests care based on that.
She says things like, if you push yourself too hard, you'll end up collapsing. So let's have your mom compromise a little. It's hard for family to make that kind of decision.
Even if I can provide care for the older clients, it is meaningless if the family are worn out. I believe that caring for the family is equal to caring for the clients. That's why, if I look at the family and notice that they are a bit overwhelmed, I suggest other options.
Care management involves identifying problems and needs and coordinating services and support so that older adults can maintain autonomy in their lives and cope with the various challenges of daily living. What exactly does the role of a care manager involve? We asked Yoshikazu Hasegawa, who has worked as a care manager for many years.
Clients are different, so it is difficult to generalize, but if I can give one goal, it is to increase the client's motivation to do something, even if it is just a little. For the client, the care manager is the person who understands him or her best. The care manager consults with the client and the client's family to create daily plans.
The care management process begins when an older adult with weakened physical and mental functions receives a care certification from a local municipality. The care manager, upon request, proposes services that are appropriate for the client and creates a care plan that combines care and support. The care manager continues to monitor the implementation of care services and the client's condition. The care plan is revised as needed to ensure that the client receives services that are appropriate for his or her condition. What are the specific steps of care management?
There are 5 steps. They include introduction, assessment, goal setting and planning, and then service provision and monitoring.
Introduction is the step that confirms the potential client's eligibility for care management and explains care management to the clients and their family. Assessment is the step that involves interacting with the clients to identify the problems they face and their desires for the kind of life they want to lead. Goal setting and planning is the step that clarifies the goals and needs to be met to live the life they want, assists clients in selecting appropriate services, and coordinates care providers and services. Service provision is the step that delivers services from providers based on the care plan. Then, monitoring is the step that reviews the status of service usage, the client's condition, and if necessary, reassesses and revises the care plan. Care coordination is an important aspect of a care manager's work. How is it carried out? What kind of skills are required for good care coordination?
One attribute a care manager needs is knowledge of social resources. Anything can be a social resource. For example, long-term care insurance services and healthcare services are social resources. A very familiar social resource is the activities of neighborhood residents associations. I think that knowledge of social resources is essential for conducting smooth coordination. An important part of a care manager's role is not just to package long-term care insurance services but to know different social resources and choose the most appropriate services and resources for the client.
A care manager needs to coordinate a variety of support in the community. Routine identification of community resources, interaction with stakeholders including residents, and care conferences are keys to successful care coordination. Well then, what kind of perspectives should a care manager have to improve their care management?
Care managers have 3 levels of perspective when it comes to care management. The foundation is survival, making sure the client stays alive through critical medical interventions such as feeding tubes and oxygen masks. Once survival needs are met, we focus on daily living, helping both clients and their families manage daily life more easily. The highest level is personal fulfillment, where we help each client live a life that reflects their individual identity and values. As care managers, we keep all three levels in mind and continuously work to better understand what gives meaning to each client's life.
Many countries, including those in Asia and South America, will continue to experience rapid population aging. At the same time, the size of families is shrinking in these countries, so a major issue is how to care for older adults in the future and how to support the families undertaking that care. One country in Asia that also has a rapidly aging society is Thailand. Thailand is an aged society with the number of people over the age of 65 accounting for more than 14% of the total population. From 2007 to 2022, JICA undertook a three-phase project with the Thai government to develop a system of long-term care for older adults in Thailand. From 2013 to 2017, JICA conducted a project on long-term care service development for frail elderly and other vulnerable people, LTOP, with the goal of building sustainable long-term care for older adults in Thailand. Unlike Japan, Thailand did not have an adequate long-term care system. Under the LTOP project, we leveraged Thailand's social resources and studied the ideal style of care for older adults in need of long-term care based on care management in Japan. Pomtep Chomchu is both deputy mayor and care manager in Bansi Tongtampum municipality in Nonthaburi province, which is one of the model sites.
3 generations often live in a Thai household: paternal or maternal grandparents, parents, and children. If someone gets sick or injured, such relatives and the community help each other. Since the LTOP project started in Thailand, there have been clearly visible changes in how long-term care is provided. One of LTOP's major characteristics is implementing care management for systematic long-term care. We brought this method back from Japan and we're applying it to practical use.
Our care manager wrote up this care plan. For example, if an older woman loses her physical strength, we provide care according to this plan made by the care manager. We are able to avoid giving improper care. Volunteers also look at this as guidance.
Mr. Hasegawa was an expert in the JICA's project in Thailand and taught care management. How can the Japanese care management system be used in developing countries? What are the points to consider?
Care management can address not only care issues, but a variety of issues. For example, there are various social issues including poverty and gender, and it is the care manager who has the skills to address such issues.
As a result of JICA's cooperation, a long-term care system that incorporates the Japanese care management system has been institutionalized in Thailand and is being implemented nationwide. In Thailand, more than 16,000 care managers have been trained, and long-term care services incorporating care management are being provided nationwide. Neighboring countries such as Vietnam and Sri Lanka are coming to Thailand to learn the system. Thailand, which has learned from Japan and developed and adapted the long-term care system for its own use, is now sharing this experience with neighboring countries. Despite the differences between Japan and Thailand, care managers play an important role in maintaining the quality of life of older adults. We expect that care management will be used in countries with aging populations in the future.